So, how worried should we be about long-term impacts from coronavirus?
Well, with COVID, we tend to talk a lot about deaths and hospitalizations. And although those are objective things that we can measure, there's a whole host of other things that go along with COVID that we should be thinking about. And this issue of post acute COVID or long COVID is something that we don't fully understand. But when you have 25 million people in the United States and millions more that are undiagnosed who have COVID, and of course all over the world, even if it's a small portion of people who have these prolonged symptoms, it adds up to a lot. And one of the things that's really difficult is that some of the things people feel are hard to measure. And we also don't fully understand what's going to happen with people. Are they going to get better? Are they going to feel like themselves? Or are they going to be this way for a long time?
And what are some of the problems that we're seeing?
So, some of the big things that people note are prolonged chest pain, shortness of breath, a feeling of being foggy or not quite sharp. People describe it as a brain fog. And again, that's a difficult one because just being sick can make you feel a little bit tired for a long time. We're talking about something that is going on several weeks after diagnosis. We usually talk about 3 weeks or more after the initial onset of symptoms, and maybe even much longer than that. One of the issues that's gotten a lot of attention is potential effects on the heart. And some of this has been in the setting of athletics. And there are some studies going on. There's one right now in the Big Ten, which Michigan is part of, looking at athletes who've had a diagnosis of COVID and what happens to them. So there's some studies being done and some detailed analysis on what does happen to athletes. And is this the same as older people or not? College athletes are going to be, of course, a pretty particular group. But there is concern that inflammation of the heart has been described, but it's hard to know how often this happens and whether it is really of consequence. Is it something that affects people's hearts down the line? And of course, we're not going to get this information in a way that's going to make it useful for someone who's sick now, but it is still important to understand. The other big, one of the other big effects is on the lungs themselves. And there's a small portion of people who develop something called pulmonary fibrosis or damage to their lungs where they're not oxygenating well and they require supplemental oxygen for a long time. And again, it's difficult to know, is this something that's going to get better with time? Is it something that they're going to live with? And in order to even offer guidance to patients and their families. And then the final one, I'm going to put in a different bucket, which is the emotional well-being piece. COVID itself can be very isolating. It can feel stigmatizing. People are often isolated from their friends and family for several days or even weeks. And that can leave you with anxiety, depression, other kinds of stress. And that's something to also be aware of. And, unlike the issues with the heart and the lungs that we don't fully understand, this one is one that we can try to address through offering support. It might be from a phone call, it might be through video, it might be waving through the window, but making sure that we are offering people love and support during this time that's difficult for them.
How long could some of these symptoms go on for? Years?
I hope it's not years, but again, in a virus that's brand new, we still don't understand. There are definitely people who are sick for many weeks and several months. And again, it's hard to know, is that an outlier? Is that someone that's unusual? Or are there a lot of people like that? And we are unfortunately are not going to know fully for a long time. And there are people sort of following people. There are investigators following groups of people. And there are a lot of communities that have sprung up on social media and other places sharing their symptoms. But it's really difficult to get a sense. But I know there are some patients that feel ill for quite some time. And I'm talking 12 weeks and even longer.
So, are any of these symptoms onset after you have the virus, or do they all happen right when you get it?
That's interesting because a large portion of people don't have a lot of symptoms with the virus. And in general, the younger and healthier you are, the less likely you are to have severe symptoms. And many of the people who are developing this prolonged, what's called post-acute COVID, many of them had a very mild case. One of the things that has come up, at least just in the few people I've spoken to, is the loss of the sense of smell. So we know that the nerves that let you smell are affected, and we don't understand why that happens, but why the virus has a tendency to disrupt that. that system. Um, Sorry about that. It looks like I have my email open. It's beeping at me
Oh,
here.
no problem. I can't hear it. You're good.
Oh, really?
Yeah.
Okay, good. Okay, I closed it. Sorry. You'll cut it up, so it'll look good.
Yeah, we
Just
want you to look your
put
best.
some B-roll. Just make me look good. So anyway, we're talking. So many of the patients who have these prolonged symptoms had very mild illness. So it's difficult to say what your illness course means in terms of having prolonged symptoms. Right now, it seems like this is very variable. And we know that in young people, for example, up to 80% of young adults, those who attend college, for example, have no symptoms or very, very mild symptoms, but are diagnosed with COVID. And what does that mean for them? Is it the same? Is it different? Right now, it's unknown. It's like a case by case. Everyone is their own case, and it's difficult to really make determinations on a bigger scale.
Should COVID be a pre-existing condition then?
Well, some of the things that COVID could leave you with, whether it might be a cardiac condition, a heart condition, or maybe on the lungs, those would be pre-existing conditions. As to exactly how that applies to health insurance and other things, I'm not sure. For me, it's really focusing on the symptoms and can we make people feel better? And that needs to be part of our focus. And I think helping reassure people that over time they should feel better and that the line to getting better is not a straight line for everyone. Sometimes they feel better one day and not as well the other. And again, in talking to a few people who have had these kind of symptoms, including some physicians who became infected, it's very frustrating because you really can't plan like, well, when am I going to go back to work? When am I going to feel better? But offering some reassurance that from what we've seen, most people do improve. It can take weeks, it might take a few months, but as long as you're going in the right direction, that's a good thing. And can we do anything in the meantime to at least make your symptoms better?
That's a great thing to hear. And my last question is, when should we know more? When will more of this research come out?
Well, there are a number of people who have these databases where they're collecting information on patients, and it's going to take a long time. This is something where there's a lot of things happening at once. You're taking care of patients that are sick now. Clinics are being set up to try and support people who have these symptoms because that's not something that exists right now. This idea of these post-COVID clinics and having the right people in those clinics, because it's not just a medical issue, it's really an emotional well-being issue. And many people have difficulty getting back to work, for example. So having all those supports, but I would imagine every single day we're getting more information that within the next several months, we may have a better idea, at least risk factors for who's at higher risk. And then thinking backwards, like, is there something we can do to help people feel better?